Welcome to the 2020 SIEDC Business Conference and Health and Wellness Expo. Here right now at our first presentation, we have something presented by the Staten Island Performing Providing System for all of your healthcare needs during the COVID era. We are going to have a short video and then have some Q&A as well too. Thank you and enjoy.
Thank you to the Staten Island Economic Development Corporation and you participating at home in this virtual meeting. Healthcare has come front and center due to COVID. There has been more change in the past 10 months than in the previous 10 years in healthcare technology, treatment, and the delivery of social services. My name is Dr. Joseph Conti. I'm the Executive Director of the Staten Island Performing Provider System. I am joined by two of my colleagues today in describing how some of the changes I mentioned above have manifested themselves into our day-to-day lives and what to expect in the future. First, a description of the Staten Island Performing Provider System, and as I describe our organization, we're going to have some background video footage of many of our partners and neighbors to set the stage. Most of these will be very familiar to you Staten Islanders. Staten Island PPS is an alliance of clinical and social service providers focused on improving the quality of care and overall health for Staten Island medical and uninsured populations, which include more than 180,000 Staten Island residents. We are led by Staten Island University Hospital Northwell Health, with a network of over 70 partners, including Richmond University Medical Center, all 10 skilled nursing facilities, behavioral health providers, home healthcare agencies, substance use disorder treatment centers, primary care physicians, and medical practices all across the island. Our focus on social need, like access to ample food, secure housing, employment, education factors known as social determinants of health, has led us to partner with a wide range of community-based organizations well known here on Staten Island, and you'll see a number in this video. Staten Island PPS has distributed over $200 million to Staten Island organizations since 2015. Our mission is to engage partners and stakeholders in the planning and implementation of population health efforts and prepare organizations to move from fee-for-service care to a value-based model of payment that focuses on prevention and wellness rather than sick care. In what seemed like the script from a science fiction movie, our lives changed in unimaginable ways less than 10 months ago when the pandemic came and caused New York to go on pause. For the city that never sleeps, a pause was unthinkable, and it has caused major disruptions to our lives. The toll on our families, friends, and fellow Staten Islanders has been severe. Hundreds of thousands of lives have been lost across America, and over 500 right here on Staten Island and counting. But our city and our neighbors have faced threats before, and as Americans, we have always prevailed with our commitment to one another and our ingenuity. In the healthcare space, technology and scientific advances have always been valued and essential ways to save lives, improve quality of life, and make it easier to get needed care. As a lifelong Staten Islander, I can say from experience that Staten Island is not the healthiest of communities. We have high death rates per capita from drug overdoses, cardiovascular diseases, cancer, and stroke, as well as high rates of diabetes, smoking, and obesity. Some of the risks are from our own choices, like lack of diet, control, exercise, tobacco use, and alcohol consumption. But the community is blessed with passionate providers of medical and social care
and many faith-based organizations to mitigate these issues to some extent. But we need access to medical services to provide integrated care to manage these conditions effectively. Together, these groups strive to support individuals in their choices and offer services to manage health, wellness, and overcome the complications from chronic disease like diabetes, cardiac disease, asthma, and mental health challenges. This past year, we worked ambitiously with a number of our partners to assess our neighbors' non-medical or social needs and found that half of the 20,000 people surveyed said food to feed their families was a number one concern. As a lifelong Staten Islander, I was shocked by this, but we and our partners responded with multiple programs to address these concerns. Then COVID hit, and there was no longer access to medical programs or mental health support in person for a good period of time. But that ingenuity I mentioned earlier immediately kicked in. Telemedicine and virtual care replaced in-person services, and soon there were as many visits happening as pre-COVID. Not in the same way, but people were seeing their doctors, therapists, and providers, getting social help, and managing their chronic conditions. As we move forward from the challenge of COVID, many of the learnings that have resulted will frame out new ways of providing care. Care that will be more convenient and patient-centered, avoiding travel and long wait times, remotely monitoring blood pressure, diabetes, and heart failure, and more access to mental health support at times throughout the day. Join the PPS as my colleagues Ashley Restaino and Sal Volpe will describe some of the new and novel ways to improve future care for our community. Thank you for joining us today. We look forward to answering your questions after this segment is over.
Good morning. This is Ashley Restaino, Managing Director of Strategic Initiatives and Operations at the Staten Island PPS. At the Staten Island PPS, we quickly worked with our network of partners to shift our priorities to focus on helping the community respond to COVID-19. We realized with our large provider network, our data, technology, and talented staff, we could virtually serve the community in a number of ways. Our main goal is making sure all Staten Island residents have access to medical care, behavioral health programs, and social services. So when we realized doctors' offices were closing, other services were going virtual, and community-based organizations were changing hours and locations, we worked quickly to survey the providers for these changes and get this information out to members of the community. One of the resources we used to do this was our website. With many medical and behavioral health providers quickly switching to seeing clients and patients virtually, we created a COVID-19 resource page with links about how providers were making these changes and how community members could access virtual services. Dr. Volpe will be speaking in a little bit more detail about these services shortly. We also created links to federal, state, and local health department sites, shared information about testing sites on Staten Island, our hospital resources, and created resource pages with changes to hours, locations, and ways to access the social services our community-based partners provide. We also used our website to set up an online request process for families to receive free masks through the mail. We received hundreds of requests and were able to get over 12,000 cloth masks out to community members when access to masks and other protective equipment was difficult to find. Please feel free to visit our website to check out more resources and information about our programs. In addition to the website, we worked to set up a mass text messaging platform to reach more members of the community to share information and resources related to COVID-19. Through our partners, we were able to reach tens of thousands of clients, sending out text messages focused on different topics every week. Messages included local or state phone numbers and links to websites covering helpful information for individuals, children, and families. People who received messages could even get their friends and families to sign up to receive the texts, so we ended up reaching about 100,000 people at the height of the curve. We at the PPS also saw that people in underserved community groups were really suffering from the effects of COVID-19, So we worked with our community-based agencies to use our other technologies to assess people for new or worsening social needs due to COVID-19. Staten Island PPS created a platform that our partners use to connect people to agencies with services like food, housing, clothing, and other benefits that are available in their neighborhoods. We applied for a number of community-facing COVID-19 grants and received a grant from the New York Community Trust to expand this program to veterans on Staten Island. We partnered with the New York City Department of Veterans Services and other veteran service organizations earlier in the year to work on programs addressing veterans' behavioral health and suicide prevention on Staten Island. With the grant, we were able to build a larger program focusing on serving the health needs of veterans while also responding to their needs due to COVID-19. Our partners have reached over 2,000 veterans, delivered over 20,000 meals, and connected many of them to services and benefits. We recently received another grant from the New York State Health Foundation, which will be used to continue to build our long-term veterans programming on Staten Island. For community members afraid or unable to access agencies or other services, we also developed a client-facing chatbot. The chatbot is a quick and easy solution to reach a large group of people at one time. A text message can be sent on behalf of any agency. People can answer a series of questions via text message, and the responses are sent to a database where agencies can reach out to people in need of services. We use the chatbot to focus on needs due to COVID-19, but we can easily customize the chatbot for any organization to reach their patients, members, or customers. COVID-19 presented unique challenges for Staten Island, but it also showed us opportunities to create a new and better normal by using innovative tools and virtual technologies to bring the community together.
Hi, I'm Dr. Salvatore Volpe. I'm the Chief Medical Officer at Staten Island PPS. I've been in private practice for over 30 years, providing care to adolescents, adults, and geriatric patients. Today we're going to talk about telemedicine from the clinician's point of view, the doctors and nurse practitioners and PAs that provide care. The topics that we'll talk about is how primary care and specialty care was affected by COVID and how they've adapted to the care, and what types of medical conditions can be treated using telemedicine. So let's talk a little bit about the pause and the period between March and May of 2020. New York State did a lockdown, so to speak, and non-essential businesses were closed. This also affected medical practices in that there was a significant drop-off in people who went to see the doctor, nurse practitioner, and PA for their health care. Nationally, between March and April of 2020, there was a 70% decrease in in-person office visits. But there was a 4,000% increase in telemedicine. So the good news is telemedicine really did help pick up the slack nationally. Locally, after surveying some of our primary care doctors, we found that the experience was pretty much the same. A significant drop in in-person office visits, and for many of the providers, but not all, an increased use of telemedicine. And what they found is that telemedicine made up about 70% of their office visits during this period. Their procedure-oriented specialties like gastroenterology and surgery did not see an increase in telemedicine visits. And that was because, as you can imagine, these are specialties that require hands-on treatment of a patient, whether it's in the office or in a hospital setting. Most recently, as we've adapted to the new normal, many of the practices have said that telemedicine represents anywhere from 15 to 30% of their interactions with patients. What were the telemedicine options that became available? Well, fortunately, the federal government loosened many of the restrictions that had been in place during the crisis because the priority was to get access to healthcare providers for patients. Many offices began using the common systems that are out there, whether it's FaceTime, Google Meet, or the very famous Zoom meetings. Some offices even use something called patient portals. Now, patient portals are systems that are connected to the electronic health records of the office and permit a patient to speak with the healthcare provider either by cell phone, a tablet, or a computer. What we should bear in mind is that as we approach the new year of 2021, the federal government will probably begin reenacting some of these restrictions unless the second surge becomes more severe. COVID-19 has highlighted many of the disparities for people in the communities that are underserved and are of color. This includes lack of access to the internet, as well as lack of access to technology. Let's talk about some of the common, frequently asked questions that patients may have. So you might want to know, what are the kinds of things that your healthcare provider can do using telemedicine? Well, in general, they can diagnose many different conditions, in some cases even rashes. They could talk about the medications that you're on, and maybe even give you new prescriptions. They can review diagnostic test results, so they may have sent you for blood tests or x-rays or CAT scans, and they can review those results with you via telemedicine, just as they would have done in person. And they can also review the consultation reports that you would have received if you had gone to see different specialists, like a cardiologist or a gastroenterologist. More and more, they're helping people manage chronic conditions, which we'll review in a few moments, like high blood pressure. And especially during that pause period between March and May, they were addressing many questions related to COVID-type symptoms. So there are two major categories of conditions that your healthcare provider might be addressing. There are some urgent ones, that you want to get care same day or within a few days, and then there are the chronic conditions, things that you probably would have for several years. So as you can see in this list, here's a series of conditions that could be bothering you today. You have a cough, or your asthma might be acting up, or you might have a bellyache, a mild bellyache. The important thing here is, even though we're showing you a list of conditions, it's really up to your healthcare provider to determine whether he or she feels comfortable managing this via telemedicine or requiring you to come in person. So this is important things to review with your doctor in advance so you can have an idea of what you can do with them in person. These are the types of things that normally many people would have gone to an urgent care if their healthcare provider was not available. On this slide, we see the chronic conditions that afflict many Americans, such as asthma, congestive heart failure, COPD, diabetes, and hypertension. Again, as I have said and probably will continue to say, it's up to the comfort level of your healthcare provider. They can probably help you manage many of these conditions if you have certain equipment in your house. So they might help arrange for you to have something to measure your blood pressure, your pulse, your temperature, even your oxygen level. They might ask for you to have something to measure your blood glucose. If you're a diabetic, you'd be doing this on your own anyway. And then something that most of us have in our home, make sure that you have a scale, because they may want to know what your weight is. So, as with any visit, communication is very, very important. So, things that you probably should have prepared in advance of whether it's an in-person visit or a virtual visit, or a couple of things. And your healthcare provider may have an even longer list that needs to be reviewed. But the common things are, one, what medications are you taking right now? Now, those things change because you may have gone to an emergency room, an urgent care, or seen another specialist, and they may have changed or added additional medications. Two, you want a list of any visits you've had with other providers in between your encounters with your current healthcare provider. Again, emergency room, urgent care, or specialists. Then, depending on the reason for your visit, your doctor might ask for you to have ready those things that we talked about before, whether it's a blood pressure, a pulse, or a temperature, so they can help address the illness that you want to discuss. And lastly, if it's a new condition, a new cough, or a new ache, they might ask you, when did it start? What makes it better? What makes it worse? And how severe is this discomfort? This was a very short discussion, and I'm sure your healthcare provider can give you much more details. But in conclusion, I'd like to say that COVID-19 has taught us to be innovative. The good thing is that many people did have access to their healthcare provider, even if it was just by phone. And that's an important thing to remember. Always reach out to your healthcare provider if you're in doubt. While it doesn't appear that in-person visits are going to disappear completely, we've learned that there are quite a few services that can be delivered virtually through telemedicine. If you haven't already done so, contact your healthcare provider and ask them if they provide telemedicine services or plan to provide telemedicine services. And then go through that checklist of things that they may recommend for you to have in the home in anticipation of future visits, televisits. Another thing I recommend is that you visit our website. We've got lots of helpful links and references, such as a list of providers who provide telemedicine, a more extensive list of questions that are often asked by patients, as well as resources for people coping with COVID-19, behavioral health issues, as well as many other problems. Thank you for your time, and stay safe.
Okay, I'm not sure if there's any questions, but I have my colleagues here, Dr. Restaino and Salvatore Volpi, and Joseph Conti will be joining in a minute. I don't know if
Hi, everybody. How are you?
Good morning.
Fine, sir. Good morning.
Fantastic. Good morning to you. Hi, how are you? Dr. Volpe, you made me laugh when you said the infamous Zoom that everyone's been attending to. Can you speak about how have you dealt with any clients or patients that have had technological issues? How have you dealt with them? Because I know even on our end, when we're sometimes dealing with small businesses or things like that, a lot of our constituencies aren't necessarily set up for the televideo, so to speak. So if you could tell me on how you face some of those challenges, that would be great.
Sure. It's a great question. And not everyone, as I said, is familiar with the Zoom platform. So I think all of us, what we've done is we've tried to reach out to whatever means is acceptable to the patient. So a lot of us have iPhones, so we're used to FaceTime. For those who have Android's got a Google Meet application, which some people might be using. But quite frankly, for a lot of situations, it went down to just using the phone. It's great to have eye-to-eye contact, but sometimes you can't. The key thing is having the communication lines open and giving the patient a chance to express themselves, not cutting them off. And then that prep time, I think, is super, super important so that there's less stress during the actual conversation because we have some of that background information in place.
Great. And Ashley, I think you had mentioned, or some of the audio was coming over, that you had you have this mechanism where people could sign up and then they have masks sent to them. Is that correct?
Yeah, so early on in the pandemic, through our website, we allowed people to sign up to receive up to 6 masks for their family. So we had procured a large number, and we wanted to get them out to the community in a safe way. So we had like a sign up process on our website. So people would enter some of their basic information, in mailing. So the good thing too is that we've kept that. So if we do need to outreach anybody else that has requested that or restart that process, we're very well situated to do that.
Excellent. As things reopen and as New York State and New York City enter different phases of reopening, how are you gearing up towards dealing with upcoming developments? For instance, so we work with a lot of small businesses, right? So the fact that restaurants can now have 25%, we were involved with that, and advising on how to reopen properly or get permits for outdoor seating. Is your organization involved in any of the what's on the horizon for you as far as the COVID-19 and how it unfolds? How is that affecting the way that you interact with individuals and constituents?
I'm sorry.
Hi, how are you?
Good. How are you doing?
Good.
So, I think our situation is very fluid, just like it is for the rest of, any domain in terms of the work that somebody does, whether it's retail or it's healthcare. And what we're trying to do right now is work with all our partners in a planning process that will take
probably the next 4 weeks for a 2021 framework for where they have their pain points, where the gaps are, and the things that they require to be successful for 2021, both in their business side and also in the quality of care that is provided to their patients. So we've developed internally and looked at some population health data, claims data, information shared with us from EMS, the district attorney's office, about overdoses and the like. And we kind of put that all, nobody likes to see how the sausage is made, but I'm kind of giving you the inside scoop as to what we do to prepare. And then we sit down with our partners. The FQHCs will be next week. The week following will be behavioral health and the nursing homes, and then small private practices. And we will develop our platform for 2021 to support their efforts, as well as, hit some very high level goals for us that include people with chronic disease, youth and adolescent, and things like that. So we have some very high level goals, but you need the people at the sharp end of the delivery system to be able to do the work. It can't just be done without their input and their advice where their challenges are.
Great, great. And speaking of the digital world, I guess is as we're on this call now and everything, where can folks find you? Are you on social media? Your website is,
Hello. Yes. They can visit our website at www.statenislandpps.org. You can also find us on Facebook, Instagram, Twitter, and LinkedIn. Just Staten Island PPS all over there.
Great, great. Those are all the questions I have in my queue. Is there anything else that you'd like to add?
So let me just add one thing, and it's kind of a little bit of a spoiler alert, if you will. We are bringing a new health plan to Staten Island in 2021. It's going to be designated the Staten Island Health Plan. So it's in partnership with Capital District Physician Health Plan out of Albany, New York. They're a regional managed care company owned and operated by physicians that is not for profit. So it's very unique. It's not a national plan that offers only one type of programming. It doesn't really take a lot of focus on a community like Staten Island. So this is going to be a very big opportunity for Staten Islanders to get health insurance through a plan that is very intent on providing services and aligned with what people need in this community, like not have decisions made in Omaha or San Diego or Washington State or something like that, Wisconsin. So this is really a big opportunity for Staten Islanders, first in Medicaid, then we'll move into the Medicare Advantage space, commercial and small employers. So this is a terrific opportunity for everybody to be part of something that has never happened before.
Great, great. Yeah, I would encourage everyone that will be listening to this and is listening live that they take advantage of that, because as you pointed out, it's very rare that, even, we've seen on the EDC side for employees and stuff that there's this hyper local, control over that. And, with so many small businesses, offering healthcare as a requirement, and as should be, obviously, there sometimes isn't a disconnect between where those decisions are made. So that's
Exactly.
great. And we look forward to hearing
Yeah,
that.
and for affordable healthcare is extremely important for small employers, and it's important for families on Staten Island. So that's what we're aiming for.
Fantastic. I want to thank you so much for having the video and taking the time to speak with us. Thank you so much.
Bye now. Take care.
All right, speak now. Bye. Take care.